So, if your child struggles from chronic ear infections, you know the drill all too well. Endless nights of pain and tears, back to back rounds of antibiotics, and the looming threat of surgery. You're tired of band aid solutions that never address the real root cause. Once you've experienced this, even just a time or two as a parent, now you begin to worry like mad every single time that they get a slight little bit of congestion or a common cold, worrying that it might spill over and build into chronic ear infections again and again and again. So for many parents, that is the exact case. It's round after round of ear infections, followed by round after round of pediatrician and ER visits, and of course, round after round of antibiotics that all come with side effects with them. So by age 3, it's estimated that about 80 to 90% of kids will experience at least one ear infection, which should get us start asking the real question is what's different about the 1 in 10 kids that does not get an ear infection. So if you'd like to stop the cycle of chronic ear infections or prevent them altogether in the first place, then you've got to watch this video all the way through. Because what if we told you that there is a way to break free from this cycle of suffering without relying on drugs or invasive procedures? So in this video, we're going to reveal the hidden cause behind most chronic ear infections and share a natural drug-free approach that's helping children find lasting relief. This video is going to be for parents of children who are struggling with chronic ear infections that are seeking answers beyond antibiotics and surgery. So, if you're tired of temporary fixes and you want to address the underlying cause of your child's infections, this information is specifically for you. In this video, we're going to be exploring and diving deeper into the surprising link between poor drainage, stress on our nervous system, subluxation, and chronic ear infections. You're going to learn how birth interventions and early life stressors can set the stage for these issues and discover how chiropractic care can help restore your child's natural drainage and their immune function. So, parents, there is hope beyond ear infections. There are many ways to help kids get through these ear infections without antibiotics, without surgeries, and all the side effects that come with them. And the natural solutions and options not only help them get through the challenges, but also make their body stronger as a result of it. So, parents, we need to start by understanding chronic ear infections. So, chronic ear infections occur when there's recurring buildup of fluids, primarily within the eustachian tube or with a lot of inflammation and tension surrounding this whole area within our body, blocking or swelling up our eustachian tube. So, all in through this area, it's the poor drainage, buildup of fluid, and the inflammation that's keeping it from draining in the way that it's supposed to. So, all of this leads to pressure and pain within our middle ear, which is commonly called chronic otitis media. So, root causes of these chronic ear infections. So, there are three primary causes of chronic ear infections, and they're all tied to something called stress stuck onto our nervous system or subluxation. So, the first is there's that poor plumbing and drainage part we were talking about, and it results from misalignment within the spine, causing extra tone and tension, as well as inflammation and limited movement caused by the nerve supply or the muscle actions in the inner ear. So this tensor veli palatini muscle causing things to get all super tight around that eustachian tube and the whole inner ear, as well as the nerve supply that's supplying that muscle. It's just things aren't working in the way that they're supposed to. So, secondly, subluxation and stress stuck on our nervous system causes our body to go into more of this excessive sympathetic fight or flight protective state, leaving us in a high inflammatory mode and producing some extra mucus. So, we already have this fluid buildup within the ear. And then now what's happening is our body's trying to create some more to get this stuff moving. And it's a recipe for disaster. You can kind of call it double trouble. There's stuff already in, we're making more of it to get it all out, but it's stuck and it's not draining. And then lastly, the world that we live in has a ton of toxins, ton of chemicals, ton of sugar, ton of dairy, and so forth that are stirring the pot and making it worse. Those are also mucus producing aspects to our diet, especially when we think about dairy and sugar, but all of those things also significantly increase our overall body's inflammation. And the other big piece of that too is it can dampen our immune response, keeping us sicker for longer. So, since antibiotics and fever reducers do not take the root cause head on and, in fact, make the gut and our immune system weaker over time, they are a major reason for recurrent and chronic ear infections continuing to come back again and again. So, in the same way, many families have gone gluten free and casein free and dairy free and added tons of supplements and essential oils and garlic drops and colloidal silver and so forth, but are still struggling, showing that those things may be helping some, but are not addressing the root cause or the stress stuck onto the nervous system or subluxation entirely. So, how neurologically focused chiropractic care works. The adjustments that we provide along a care plan are designed to provide two main things that help these kiddos and these patients get to the other side of ear infections without drugs and without surgery. So they increase the drainage and increase the plumbing by getting things moving and clear once again, often immediately. It balances out our nervous system. It helps to reduce that sympathetic fight or flight state, to reduce inflammation, and just overall take stress and tension away from our bodies. So within our office, the path to natural solutions and overcoming ear infections begins with what we call our neurological insight scans. So this test, these pieces measure directly the stress and the tension, the inflammation and subluxation that so often builds up within the upper neck of our infants and our children that are struggling with chronic ear infections, stemming all the way back from birth interventions like forceps and vacuums and cesareans that create physical tension, twisting and pulling to the upper neck and the middle ear areas, which all are leading to this trouble within the first place. So to learn more about how chiropractic can help your child overcome these challenges and to get your child scheduled for these insight scans, check the link within our bio and learn more about this in our process today.